In this episode of the Mel Robbins podcast, Dr. Jen Gunter joins Mel Robbins to debunk common myths and misinformation surrounding women's health. The conversation is rich with insights, addressing everything from the anatomy of the vagina to the complexities of menstruation and the pervasive myths that often cloud women's understanding of their bodies. Dr. Gunter begins by clarifying the terminology surrounding female anatomy, emphasizing the importance of understanding the difference between the vulva and the vagina. The vulva refers to the external parts of the female genitalia, while the vagina is the internal canal. This distinction is crucial, as many women are often confused about their own anatomy, which can lead to misinformation and unnecessary embarrassment. One of the most misunderstood aspects of female anatomy is the hymen. Dr. Gunter urges listeners to forget the concept of the hymen as a marker of virginity, explaining that it is a remnant of tissue that varies greatly among individuals. The idea that the hymen breaks during first intercourse is a myth. Many women do not experience any bleeding or discomfort during their first sexual encounter. The notion of virginity being tied to the state of the hymen is a social construct rather than a medical reality. A significant portion of the discussion focuses on the marketing of feminine hygiene products, which often perpetuates the idea that women's bodies are inherently dirty or in need of special care. Dr. Gunter emphasizes that the vagina is a self-cleaning organ, and the vulva, being skin, does not require any special cleansers or products. The use of soaps or wipes designed for feminine hygiene can disrupt the natural pH balance and lead to infections. Instead, a gentle cleanser used on the external vulva is sufficient, and there is no need for internal cleaning. Dr. Gunter also addresses the myth that certain foods, like pineapple, can alter the smell of vaginal secretions. She firmly states that such claims are unfounded and that the vagina should not smell like a tropical fruit. The idea that women need to modify their natural scent is rooted in harmful societal messages that suggest women's bodies are undesirable as they are. The conversation then shifts to vaginal discharge, which is often a source of concern for many women. Dr. Gunter explains that it is normal to have a certain amount of discharge, which serves to keep the vagina healthy by shedding old cells and maintaining moisture. She notes that variations in discharge can occur throughout the menstrual cycle, particularly during ovulation. However, if the discharge changes in color, consistency, or odor, it may indicate an underlying issue that warrants medical attention. Dr. Gunter highlights the importance of understanding the signs of common conditions such as bacterial vaginosis and yeast infections. Both can present with similar symptoms, but they require different treatments. She encourages women to seek medical advice if they experience unusual symptoms, rather than self-diagnosing based on information found online. Menstruation is another key topic of discussion. Dr. Gunter debunks the myth that menstruation is a process of expelling toxins from the body. Instead, she explains that menstrual fluid consists primarily of blood, endometrial tissue, and cervical mucus. The idea that menstruation is a cleansing process is a misconception that can lead to unnecessary shame and stigma. One of the more surprising revelations is the phenomenon of period diarrhea, which affects a significant number of menstruating individuals. Dr. Gunter shares her own experiences with this symptom, emphasizing that it is a common occurrence linked to hormonal changes during the menstrual cycle. This aspect of menstruation is rarely discussed, leaving many women feeling isolated in their experiences. Dr. Gunter expresses her skepticism towards alternative medicine, particularly when it comes to women's health. She emphasizes the importance of evidence-based medicine and the need for treatments to be backed by scientific research. Many alternative therapies lack the rigorous testing required to ensure their safety and efficacy. She cautions against the allure of quick fixes and urges women to seek out reliable medical advice instead. The discussion also touches on the impact of social media on women's health. Dr. Gunter notes that fear-based marketing often drives the promotion of products and treatments that are not necessary. She encourages listeners to be critical of the information they encounter online and to seek out reputable sources such as medical organizations for guidance. Throughout the conversation, Dr. Gunter emphasizes the importance of empowerment through knowledge. She encourages women to advocate for their own health and to feel confident in discussing their bodies with healthcare providers. By understanding their anatomy and the normal functions of their bodies, women can dispel myths and make informed decisions about their health. Dr. Gunter also addresses the societal pressures that women face regarding their bodies, including the obsession with pubic hair grooming. She explains that grooming is a personal choice and that there is no medical necessity for hair removal. The decision to remove or maintain pubic hair should be based on individual preference rather than societal expectations. The conversation takes a turn towards sexual health, particularly the myths surrounding female orgasm. Dr. Gunter highlights that many women do not achieve orgasm through penetrative sex alone, and this is perfectly normal. The idea that a penis is the primary means of achieving orgasm is a misconception that can lead to feelings of inadequacy. She encourages women to explore their own bodies and understand what brings them pleasure, whether that involves the use of vibrators, clitoral stimulation, or other forms of sexual activity. Dr. Gunter also addresses the issue of pain during sex, emphasizing that it is not a normal experience. Women who experience pain should seek medical advice, as it can be indicative of underlying conditions that require treatment. She reiterates the importance of open communication with healthcare providers and the need for women to feel comfortable discussing their sexual health. As the conversation progresses, Dr. Gunter touches on menopause and the changes that accompany this life stage. She explains that hormonal fluctuations can lead to various symptoms, including changes in vaginal health. Many women experience dryness and discomfort during menopause, which can impact their sexual health. Dr. Gunter encourages women to seek out treatments that can alleviate these symptoms, such as hormone replacement therapy, if appropriate. Towards the end of the episode, Dr. Gunter discusses the importance of nutrition and lifestyle choices in maintaining overall health. She emphasized the benefits of a high-fiber diet, which can support digestive health and reduce the risk of various diseases. She encouraged listeners to focus on whole foods and to be mindful of their dietary choices, rather than falling for the latest diet trends or cleanses.